Prevention of pediatric injuries, I think, is very important, especially with the way sports are going now, with kids really trying to, it seems, concentrating on one sport and almost never having a break of that sport like it used to be, of playing 3-4 sports. The key is to avoid overuse injuries, and I think if they can remain in shape all the time, so that again, if they're playing one sport, it's hard to go out of shape, but it's, if they have a layoff and they really take it easy, couch potatoes for the summer, and then expect that they're going to be at the same level when the fall season starts, that we see a lot of stress injuries the first and second week of September. After double sessions, they just haven't done enough training to prevent it. So preventing getting out of shape in the off season, I think, is probably the biggest thing. To start and have a vigorous regimen of pre-participation strengthening is a great way. It's hard. I mean, I think some of these devastating injuries that occur in football and most of the collision sports is where you get those ACL injuries. Those are treated much better now with reconstruction if necessary, or bracing, and awareness of some of those injuries. However, prevention's hard. I mean, you have to, either you play or you don't. You can put yourself in harm's way or not. So it's, I think, safe play, making sure that they don't overuse them, and if you find themselves in a league that they're finding that there are unnecessary injuries because of poor officiating or poor coaching or that kind of thing, maybe avoidance of those things. As far as avoiding overtraining, I think the main thing is if they just take a common sense approach to it. I mean, I wouldn't do heavy lifting for a child, but there's really nothing wrong with them participating in a fashion that I think their parents and coaches will know. I don't think they're going to be trying to bench press, 300 pounds as an 8-year-old. They're not going to do the heavy weights. I think the key is to perhaps do lighter weights with more reps. Most kids just don't like that kind of repetitious thing at a young age anyway. It's the teenagers that you're almost trying to keep out of the gym, not doing too much. So that really isn't particularly a bad problem. I think the one is couch potato to season that you have to avoid. That's probably the biggest one. If they can just stay active with fun things, that's what kids want, not a strength training or avoidance of that. That hasn't been a big clinical problem in my practice.